January 2026, United States. A man opens his mailbox and freezes. Inside is a single piece of paper. No warning, no buildup, just a number that doesn't make sense. $48,000 for a hospital visit that lasted less than 24 hours. This is not an exception. It is a pattern. In the United States, healthcare is not just expensive. It is uniquely expensive. The same procedure that costs a few $100s in one country can cost tens of thousands here. An ambulance ride can cost more than a cross-country flight. A routine surgery can turn into long-term debt. And yet, the United States spends more on healthcare than any other country on Earth. So where is all that money actually going? To understand that, you have to look beneath the surface, past hospitals, past doctors, and into a system that is far more complex than it appears. Because in the United States, healthcare is not a single system. It is a network of overlapping systems: insurance companies, private hospitals, pharmaceutical giants, billing networks, and government programs, all interacting in ways that are often invisible to the patient. And every layer takes a cut.
Unlike most developed countries, the United States does not operate on a centralized healthcare model. There is no single entity negotiating prices across the board. Instead, prices are fragmented, negotiated privately, often inflated before they are ever reduced. This creates a number that rarely reflects reality, but always affects the patient. Hospitals don't simply charge what a procedure costs. They charge what they expect insurance companies to negotiate down from. This leads to artificially high base prices, known internally as charge-master rates. These prices are often several times higher than the actual cost of care. But here's where it gets more complicated.
At this point, the system isn't just expensive, it's layered in ways most people never see. Because the cost of healthcare isn't just treatment, it's everything behind it. Before money reaches a doctor, it moves through billing teams, insurance checks, coding systems, and claim processors. Entire departments exist just to decide who pays what. You're not just paying for care, you're paying for the machinery around care. And that machinery adds up fast. Then there's the pharmaceutical side. In many countries, drug prices are negotiated centrally. In the United States, they're fragmented. So prices aren't just based on cost, they're based on what the system can tolerate, which is why the same medication can cost multiple times more depending on where you are. Same product, very different price. But the deeper issue isn't just pricing, it's incentives.
Hospitals and providers aren't just treating patients. They're operating inside a system that rewards activity. More tests, more procedures, more interventions. More activity means more revenue. Now add legal pressure. Healthcare operates under constant risk of lawsuits, so providers take extra steps. More tests, more checks. It's called defensive medicine.
Let us know in the comments if you would like an in-depth analysis of the healthcare systems and how the entire network operates. Consider hitting subscribe if you enjoyed this content. Stay healthy and keep that insurance updated. See you on the next episode of the EzPZ Show.